Good morning. I'm Dilshad Mohammed, a program manager at the South Carolina Department of Health and Environmental Control. It is my pleasure to welcome you to this presentation on obesity prevention of African American women in South Carolina. We have an exciting session. Let's get started. For today's presentation, I'm going to start with the target population and then I'm going to walk through background and obesity determinants in a target population. Before looking at potential interventions recommended, the available resource will explain why these recommendations can be considered. Then I will conclude with appropriate recommendations to reduce or prevent obesity in African American women in South Carolina. Obesity is a complex, serious, and expensive public health issue. Overweight and obesity have become major health concerns in the United States, impacting women, especially African American women. 76% of African Americans in South Carolina are overweight or obese. For African American women, the number is 3 out of every 4. South Carolina has the 10th highest adult obesity rate in the nation. 4 out of every 5 African American women are obese. Diet and behavior related diseases like obesity are higher among African Americans. Obesity prevalence in the United States is higher in rural areas, especially among racial or ethnic minorities. I'm proud to say that South Carolina Department of Health and Environmental Control works with partners across the state to address nutrition, physical activity, obesity, and other chronic conditions. The Council worked with organizations across the state to develop 2014 and 19 Obesity Action Plan. Eat Smart, Move More Coalition of South Carolina is public-private partnership that aims to lead a unified movement to make the healthy choice the easy choice regarding good nutrition and active living. If we look at the background, approximately 82% of African American women are obese. The economic cost of obesity in South Carolina is estimated to be 8.5 billion per year and growing. African American population is large in southern states like South Carolina, and these are disproportionately burdened by obesity, physical activity, and poor quality diets. As per 2014 data, 30% of African American households with children showed low or very low food security. Over the last few decades, the prevalence of obesity has increased significantly in African American women. Due to exposure to the marketing of low nutrition foods and less access to recreational opportunities, the situation is more sedentary with incredible stress levels. Stress levels could be because of unemployment, housing, social, and many more. Many contributing factors lead to an imbalance of calories and energy expenditure and ultimately to obesity. Eating outside the home has increased. Consumption of high calorie drinks has been linked with obesity and physical activity levels are low. Misperception of weight also play a role. I want to explain obesity determinants with the help of social ecological model. It has commonly been used in public health research to explain and identify the etiology and complexity of obesity. It has 5 levels. All the determinants causing obesity in this population can be understood with the help of these 5 levels. At individual level, factors such as genetics, poor quality of diet, exercise, behavior, and motivation can lead to obesity in this population. Lack of self-confidence, knowledge, and motivation to achieve a healthy weight are other influential factors. The role of family, friends, social networks, and time constraints to prepare food can lead to obesity at the interpersonal level. At the organization level, availability of soda and other unhealthy food and snack choices, vending machines are the influential factors. Women with college educations are working multiple jobs, resulting in limited time for food preparation and exercise. Black women experience racism and discrimination at workplace, causing racism stress that may cause obesity. At the community level, the community built environment is an area of concern as it lacks opportunities for physical activity and access to healthy foods, leading to obesity. Limited community resources and long physical distance to resources can lead to obesity. Socio-economic characteristics of the community also play a role. At the public policy level, media that advertise the types of the food in the local community may lead to obesity. The others include lack of neighborhood safety policies, zoning regulations, and non-affordable prices of the food at the local stores. A South Carolina faith-based intervention showed significant increase in self-reported leisure time moderate to vigorous intensity physical activity. Another church-based intervention from 74 churches in South Carolina demonstrated improved physical activity levels and nutrition. Available literature recommends that successful community-based interventions focused on obesity in African American women should engage faith-based organizations, community organizations advocating for African American women's health issues and community advisory boards to design interventions promoting social support and environmental changes for lifestyle modification. Hence, I am recommending these three interventions to the South Carolina Department of Health and Environmental Control. The first intervention I would like to recommend is the community-based intervention called I Am Women program. This program sought to address the disconnect between nutrition-related knowledge, attitudes about healthy eating and exercise, and adopting behavior that supports improved health. The program's importance on nutrition and physical activity reflects support for a highly targeted community level strategy and intervention to help African American women and their families acquire and maintain healthier lifestyle behavior. Though the program is a community-based, culturally responsive, and gender-specific nutrition, obesity, and diabetes educational prevention program designed for African women, it can be explicitly implemented in obese women. The second intervention is a church-based weight loss intervention in African American adults using text messages called the Lifestyle Changes Through Exercise and Nutrition (LEAN) resulted in significant weight loss and improved quality of life. Many reviews have shown that M-Health interventions can effectively promote weight loss. The LEAN study demonstrated that church-affiliated African American participants were receptive to receiving SMS text messages related to behavioral strategies as a part of weight loss intervention. Research indicates that mobile phone text messaging is an emerging platform in physical activity interventions with African American women. The study findings guide the development of M-Health intervention approaches for physical activity promotions that are likely to appeal to African American women and increase engagement and behavior change. Obesity interventions in African American faith-based organizations, FBOs. Due to the importance of faith to many African Americans, FBOs can be effective venues for delivering health messages and promoting healthy behaviors. African American FBOs, including churches, mosques, and temples, provide a real-world setting to conduct lifestyle interventions targeting health promotions and disease prevention. African American clergy reported believing in the connection between health and spirituality, and they are interested in participating in health-related programs. Black churches united for Better Health project on increasing fruit and vegetable consumption among rural African American church members in North Carolina. The project was a successful model for achieving dietary change among rural African Americans. A church-based, culturally specific dance intervention in African American women reduced obesity and improved women's health. Most of the studies reported a statistically significant outcome. All three interventions, IAW program, LEAN, and FBOS program, were developed for African Americans which showed great results. Since the South Carolina Department of Health and Environmental Control promotes faith-based interventions, health-related programs, and activities focusing on physical activity and nutrition, the obesity interventions in African American faith-based organizations may be best choice. I hope to see that Council will consider these remarkable interventions to implement in African American obese women to reduce and prevent obesity. I thank you all.